To whom it may concern, semicolon, new paragraph. Pursuant to your request, comma, I am writing a narrative report for the chart review of VIA, spelled VILLA, versus Allstate. Period, new paragraph. Summary of medical records, colon, new paragraph. A summary of the medical records as it pertains to the right knee is as follows, period, new paragraph. On June 15, 2017, the plaintiff Donna Villa was a restrained driver in her vehicle, period. A car pulled in front of her, which caused her to strike the oncoming vehicle on the side, period. The airbags were deployed at the scene, period. There was no loss of consciousness, period. She was taken to McNeil Hospital via EMS, period. When at the hospital, she was evaluated for multiple injuries, period. She was complaining of right knee pain, period. X-rays of the right knee were performed and showed arthritic changes with joint space narrowing of the medial tibiofemoral joint space, as well as large medial osteophytes, period. There was also a lytic lesion noted on the medial proximal tibia, period. She was diagnosed with a right knee contusion, period. Thereafter, she was seen by her primary care physician and was also seen at Advanced Physical Medicine on June 22nd, 2017 by Dr. Alexander, Alexandr Goldvecht, Goldvecht, period. He diagnosed her with a right knee contusion, prescribed her naproxen as well as Flexeril, period. She was to follow up in 4 weeks, period, new paragraph. She followed up on 7/20/2017 and continued to have pain and discomfort in her right knee, period. On examination, she had crepitus with range of motion of the right leg, period. Once again, she was diagnosed with a right knee contusion, period. An MRI of the right knee was ordered, period. On August 10th, 2017, she returned for MRI follow-up, period. She continued to have pain in her right knee, period. The MRI suggested a torn ACL as well as a medial meniscus tear involving the posterior horn and mid-body, period. The rest of the knee was unremarkable with the exception of prepatellar soft tissue swelling, period. She was asked to follow up with an orthopedic surgeon. On 9/7/2017 was her final evaluation, period. She was deemed at maximal medical improvement for her lumbar spine, and she was asked to follow up with an orthopedic surgeon, period. She also attended physical therapy at Advanced Physical Medicine Centers from June 29th, 2017, and her final physical therapy visit was on September 2nd, 2017, period. The MRI of the right knee report suggests torn ACL, joint effusion, medial meniscus tear involving the posterior horn and mid-body, as well as peripatellar soft tissue swelling, period. I reviewed this MRI and I am in agreement with this report. However, I do not feel that the ACL is an acute injury, period. I do not see any bone marrow edema noted on the on the femoral tibial surface, period. The joint effusion is small, and I would expect something larger for an acute injury, period. New paragraph. On August 23rd, 2017, Ms. Villa followed up with Dr. DeBartolo, Debartolo, who is an orthopedic surgeon, period. On examination, she had range of motion of 0 to 90 degrees, period. The MRI was reviewed, period. He diagnosed her with an ACL tear as well as monoarthritis, period. He felt that her symptoms were due to pain and not due to instability, and a steroid injection was administered, and she was asked to return in 1 month, period. Of note, she also has a past medical history significant of rheumatoid arthritis, period. I then reviewed the deposition given by Donna Villa on November 13th, 2018, period. Significant findings were that the patient had previously received cortisone injections into the right knee by her rheumatologist for knee pain, period. The one prior to the one administered by Dr. DeBartolo was at least 6 months to a year, and that she had another injection following the one related to the accident, period. She states that the injections provide her with approximately 6 to 9 months of relief, period. Additionally, she has received physical therapy to her right knee several years ago, but does not recall exactly when or where she had the therapy, period. Specific interrogatives. Question number 1. What, if any, injuries did Donna Villa sustain as a result of the accident of June 15, 2017? Donna Villa sustained a right knee contusion as well as aggravation of pre-existing osteoarthritis of her right knee, period. Her x-rays at the time of the accident showed joint space narrowing and osteophytes, which are suggestive of degenerative arthritis, period. Thereafter, she received a cortisone injection, which alleviated her symptoms, period. Prior to this accident, she was receiving cortisone injections at a frequency of every 6 months to a year for her right knee discomfort, period. It is my opinion that the accident exacerbated or temporarily aggravated her right knee osteoarthritis, period. She received a cortisone injection and returned back to her baseline, period. According to her testimony, she then received a cortisone injection for her, quote, rheumatoid arthritis, quote, pain by her rheumatologist later on, period. She also sustained a right knee contusion as noted on her MRI, which describes some peripatellar soft tissue swelling, period. This peripatellar soft tissue swelling is suggestive of a knee contusion. Question number 2. What medical care and treatment was necessitated by the accident? New paragraph. The medical care and treatment that was necessitated by the accident is visit to the emergency room and diagnostic imaging, visit to her primary care doctor, visits to advanced physical medicine for evaluation by the physician as well as the physical therapy, the MRI, and her visit to the orthopedic surgeon and cortisone injection, period. New paragraph. Question number 3. To what extent, if any, do Donna Villa's pre-existing medical problems contribute to his or her alleged present state of ill-being? New paragraph. Donna Villa has pre-existing rheumatoid arthritis, which affects her right knee, period. She was seeing a rheumatologist and receiving cortisone injections into her right knee for every 6 months to a year, period. Based off of x-ray, she also has osteoarthritis of her right knee, which, in my opinion, she was receiving the cortisone injections for, period. When she had the accident, she injured her right knee, which caused a temporary aggravation of her right knee osteoarthritis, requiring a cortisone injection by the orthopedic surgeon, period. Thereafter, she returned back to her baseline, period. Question number 4, what, if any, disability period is related to this accident? The disability period as it relates to this accident is from the date of the motor vehicle accident, which is June 15, 2017, till the date of last physical therapy, which is September 2nd, 2017, period. She received a cortisone injection from the orthopedic surgeon on August 23rd, 2017. Period. What, if any, permanency is related to this accident? There is no permanency as it relates to this accident. Question number 6, based on a review of the 7-29-17 MRI of Donna via knee, do you agree or disagree with the radiology report of Dr. Kuritza? New paragraph, I do agree with the findings noted by Dr. Kuritza, Kuritza. I would only add that there was no bone edema noted on the femur or tibia, which to me suggests that the ACL is a old injury, period. Additionally, there was no significant joint effusion, which is something I would expect from an acute ACL injury, period. As such, I do agree with the report that there is an ACL tear, but I would add that this is a old or prior injury and not acute relating to the car accident. Question number 7, were any positive findings in the MRI of 7-29-17 causally related to or aggravated by the accident on 6/15/2017? New paragraph, as stated previously, she had an aggravation of pre-existing osteoarthritis, period. The osteoarthritis was noted on x-ray and also noted on the MRI, period. It is my opinion that the meniscal tear and ACL tear are old injuries and not related to the accident, period. Clinically, she had no episodes of instability, period. The positive finding of peripatellar soft tissue swelling is related to the accident and is suggestive of a bone contusion, period.